السلام عليكم ورحمة الله وبركاته. أسعد الله صباحكم. يسعدني ويشرفني أن يكون معنا اليوم الدكتور محمد المنصور، وهو أستاذ مشارك في قسم التعليم الطبي، وله خبرة أكاديمية كبيرة، حيث عمل في جامعة الملك خالد وفي جامعة المجمعة فترة من الوقت، وهو استشاري طب الأسرة، ولديه حصيلة جيدة من الأبحاث في مجال التعليم الطبي وطب الأسرة. سيحدثنا اليوم عن موضوع هام، وهو Medical Education Research Directions Post-Pandemic Practice. Welcome دكتور. نعتذر من عدم تسجيلها السلام ورحمة الله وبركاته. ما سجلناها في زوم، لكن أبشركم إن شاء الله سننوي عرضها في اليوتيوب القسم. كثير من الزميلات والزملاء اعتذروا بسبب التزامهم بالتدريس، وشكرا على للمحاضر وللحضور. نعم.
ولا تحتاج تقرب؟ طيب اوكي. طيب تسمحوا لي بس اشيل الماسك مثلا عشان الصوت.
لا احسن
اكثر وضوحا. طيب بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Good morning everyone. I'm really glad to be with you today, and I would like to thank Prof. إياد الفارس and the Medical Education Research Chair for their invitation. Actually, the story of this presentation was just I approached Dr. Prof. الفارس to just try to be part of this wonderful work in the Medical Education Research Chair, and he really invited me to present something for you, and I'm really happy to share with you. Today it's going to be more of discussion. As you know, the medical education research is very huge and broaden field. So today I will just shed some lights on what's been there in the latest medical education conferences and the literature. What is in there in particular of this pandemic and the effect of the pandemic on the medical education practice and being reflected in research. So I hope inshallah I will not take a long time, and I'm really keen to hear from you a lot of discussion about what can we do in this regard, and to convert this to something that can be on the ground and help everyone. So in the beginning, I don't know if is it clear from here?
Yes.
Okay. طيب. Our agenda today, we're gonna go through our objectives. I don't have a lot of objectives, it's just three. Some introduction about what happened during the pandemic, what's the changes that been there, and I'm sure that most of you aware of all of these details. Then I will put some directions that I observe personally, and I want to hear from you also. What are the directions that also you exposed to in this post-pandemic era? And also I'm going to focus about some methodology, because there are a lot of changes in methodology in medical education research recently. Then I will reflect back on our practice here, specifically to the medical education research in the kingdom, and through the chair perspective. So these are my objectives. I will describe some medical education research fields directions that I noticed lately. هذه قفلت يا دكتور.
عفوا.
التسجيل يبدو فيه إشكالية، بس ما أدري. اللي يحتاج إني okay. Just I need to refresh it maybe. Secondly is the objective. Second objective is to discuss some methodological trends, as I said. Then we're gonna reflect on our approach in a chair perspective or chair scope. I found this very interesting. This was published in 2020 or 2021, maybe January. So it was by Ministry of Communication and Information Technology. It was really fantastic report, and they call it post-COVID-19 new reality. And we heard a lot of this, that whatever been there pre-COVID, it's totally will not be the same post-COVID. So we hear these terms, post-COVID era, post-COVID education, post-COVID research, and post-COVID healthcare practice. So these terms nowadays is being there in the literature for a while, and it is really reflected also in the other aspect, other than healthcare, other than education. It's been beyond to the finance, to the policies, and also to the technology and the digitalization of the society itself. So I just select from that report what's been related for us. The health sector changes. They mention some examples. So they get the Chinese example that one of the famous application for telehealth that was used before the pandemic, it was 350% increase in that use after the pandemic. And this can be also applied for many applications that using the technology to provide health. What about us in KSA? We were lucky actually during the pandemic that we have infrastructure that helped us a lot to maintain our healthcare practice. And some of those telehealth, let's say, modalities being evolved before, then maximally advanced during the pandemic, like صحة application, صحتي, أنات, all of these applications that we are using nowadays, it was in very excel evolvement during the pandemic. Also the 937, and they are receiving millions and millions of consultations. So the numbers is really expanding toward using the technology in healthcare. This was a wonderful review about what are the healthcare transformations in post-pandemic era. And I like what they just illustrate as a dimension, that the dimension of changes in post-pandemic was in three dimensions, in behavioral dimensions, in the action or actors, the people that they are leading these changes, and the technology itself, or the technical dimensions. And they mentioned that a lot of these dimensions been interacting with each other, and the organization like the WHO, the FDA, Saudi FDA, all of them, they have a contribution in this transformation. Also the funding, the policy making, all of these been interacting to each other. So all of these is about healthcare practice. So what about the education? What about the research? So can we merge those three? Is it interacting with each other? Actually, yes. Case Vanderbilt, he said a long time ago that the educational development is really interacting with the educational research. But nowadays it is more than this. So our medical practice is also interacting with the health, with the medical education practice, and all of these has been interacting with the research. So as you can see, that whatever been there in the practice, it's been affecting the research and vice versa. So we are talking here about undergraduate, postgraduate, and also the professional development for a perspective, a huge perspective of medical education, either practice or research. And it's been also really interacting a lot with the medical practice or the healthcare practice, let's say, in general. And during the pandemic, as all of us been exposed to that, a lot of our educational activities converted to be virtual. Also our clinical practice, most of it been converted to virtual. And a lot of research being published, so we just gonna resume. So that, as we said, that it is well connected to each other. So whenever we think about any change in one aspect, it's gonna affect the others. And we practice this. We lived in that experience deeply. So my focus today, as I said in the beginning, so it will be about what are those directions that I personally notice it, and I'm really keen to hear from you also some new trends that you noticed. In medical literature, they published a series of post-COVID or during COVID review, and one of updated one in BAME is about the development of medical education response in response to COVID pandemic. So it was mainly to synthesize what's been published there in the medical literature or medical education literature in particular, and they found that United States is most of the publication came from there. Europe with 15%. Our Middle East is 8.7, and so on. And most of these was shared between undergraduate and postgraduate, and some are mixed, and some are toward the CME or professional development. What about the focus of the development? So we are talking here about what are those things being changed in the education, practice, and published. So I'm talking here about published and being reviewed by the authors. So they mention a lot about the technology. How does the technology been shifting the in-person education to be virtual with the different scope of virtual. Also the telehealth here is a part. So as we said, that the practice is a sort of education at the same time. The surface recognition, the simulation effect, it's very huge. Now the simulation paper is being expanding in the literature during the pandemic and after the pandemic. How does the simulation help, and what's the limitation of using simulation? How can we improve our simulation design and simulation practice and so on? The assessment was having a lot of also changes. Can we keep our OSCE as a virtual, for example? There were some studies talking about this. Can we shift our assessment to be totally virtual or totally online, and so on? Some talk about the how about the admission, selection, what about the graduation of our graduates, and the faculty development also has some focus on that review. And what's been really interesting, that most of those published articles, and according to this review, is mainly in the level 1 of Kirkpatrick effect, which is the satisfaction of either satisfaction of the learner or satisfaction of the educator. So just very few of them, they are going to level 2 or level 3, and very few going to beyond that. As I said, that the technology was, the digitalization in general was in the heart of all of these transformation, either in practice or in research. And as you can see, that a lot of research is being directed to this. How to tackle having technology enhanced learning. This is a very huge scope of research, and still this is why the message that why we are talking today about the direction. So still this part of the new priorities, let's say, of our medical education research is still need a lot of work, especially if we want to see the long-term effect of having the either blended learning or purely online learning in some subjects. Another very nice review, and it includes around 12 projects that's been done here in our local context. It was showing that the training, the education and research during COVID times has some innovations and methodology that's been approached or used, either modified or for the first time. I just quote one of the interesting conclusion of one of those projects that they mention here that we have to consider after the COVID that our local contribution is really can be integrated in with the similar ones in the global perspective, of global scale and context, to provide a global scientific collective action. And also, as you just noticed during the COVID, that many of the journals they put a track for the COVID publication, and people start sharing easily a lot of their thought, a lot of their application, even in a small context, and they just share it with other scientific community on the globe. Another important player was during the COVID-19, which is let's say the mathematical models, the big data, the artificial intelligence, machine learning, all of these terms that we always been exposed to during the pandemic was really a huge during the pandemic, and I think it's gonna still exist and evolve more. And by the way, we have a lot of things that can be shifted from the healthcare practice toward the education practice. Like, for example, the prediction, the mathematical prediction of number of diseased patients, number of or the outcomes in general that been sometimes it was the major pillar of the decision for some countries, that they based their decision according to the mathematical models, either in predicting number of cases that they are expecting or predicting the outcome of the vaccine or whatever. So implication of those big data, mathematical models, and the biomedical education in general on our education is very, very important research direction, and it's still in the infancy for us in the medical education practice. So we need to find a way. For example, the digitalization of the education, the personalizing education. So how can we utilize those data that we have during the pandemic and before and after the pandemic, and start talking about personalizing our education versus personalizing the medical practice, which is evolving now, and so on. Another interesting review about the impact of COVID-19 on the clinical learning environment. As you all know, that the learning environment is really important aspect of our medical education in general. And during the pandemic, there were a lot of disruption on the level of the person, on the organization and physical virtual spaces, and also the social space. So this okay. It's okay. We're gonna resume. Okay. So in this interesting article, so they review some of the gaps and opportunities on those 4 dimensions. So still it is still an area of research. So what we are doing on the personal space, for example, the student or learner well-being during the COVID. What about it post-COVID? Is there any changes that been changed, especially those graduates? They graduated during the pandemic, so are they doing fine on those levels, on their personal level, how they are interacting with their patients and their colleagues? What about their social responsibility? We have a lot of opportunities being raised there in the social accountability for us as healthcare providers, and also for our student as a learner. So they learn how to be social accountable by the force of the situation that we faced during the COVID-19. And as we are proud here in King Saud that most of our students, they are volunteering in the vaccination and during the pandemic in different places. So this social accountability, it has an educational impact, and also it is an area for research. So that's really still a huge aspect for us to go in research about this. One of the old notions about the directions of the medical education, when I'm saying old, that it was there before pandemic, but it was really encouraged and enhanced post-pandemic. Like, for example, having an international medical educator. So the people in medical education, they are, since I think 10 or 15 years, they are talking about how can we evolve to be more of international medical education, to be global educationists. How can we just go beyond our boundaries of our geographical, our cultural boundaries, and start to disseminate the knowledge. And pandemic was really a very great opportunity for those people to prove that this is really gonna work. And we found a lot of courses being open for everyone from high prestigious university. They open some online or on-demand courses. So a lot of this dissemination of knowledge, it's been as an opportunity after pandemic. And also it will give some thought for our researchers, especially in medical education. So how can we expand this experience and towards what we call international medical education? So we have a lot of in common between all the medical educators around the globe. I just put here some highlights on some directions that it was there before the pandemic, but it's now more increased, especially with shifting more toward virtual or blended learning. Gamification, for example. Gamification was there for around 15 or 20 years, but it was there as something on a side, something for a trial. Now they have a lot of success, and with change in our generations, our learners' generations, it's been really important to not just have this as something on a side, but we can implement some of gamification in our medical education, and we have to test it as a researcher. So gamification, for example, during the pandemic, it has a lot of involvement. The professional identity, intersectionality, equity in medical education, diversity, biases, is those terms being raised a lot, especially with the social and community movement that happened before and during and after the pandemic. As we all know that what happened in USA, for example, after George Floyd, a huge disaster there, and a lot of talk about racism. How is the racism been affecting our medical practice. And there is a response now. For example, in NICE guidelines, they start to eliminate some of the race-based recommendation. For example, they are taking off the race from the EGFR, for example, and some of the recommendation that's putting the race as a determinant. It was studied and showing that it was the evidence behind it was very weak. So those movement, let's say social movement, affecting the practice, and it will affect also the medical education research and medical education practice. So these are an example, and a lot of talk about those topics. One more thing about learning environment, as we just said, the biases, the intersectionality, and so on, and the identities of the educators. So these are talk. It was before just again it was just on a side, but now it is one of the major talk that been in the conferences or high conferences in the globe. And I will give you an example. I will just put here some thought about the Ottawa conference. It was in the middle of the COVID, and the focus was about the assessment. And here I just mentioned 3 of their directions that they mentioned that it is important. As we all know about programmatic assessment, it's been evolving since 10 years from the Netherlands school, Maastricht school. APAs with OLICATE is being now evolved hugely and fastly. So it is again an area for research for our researcher. Is it fit for us? Is it good for everyone? Is it applicable for our undergraduate, for example? Is it applicable for professional development, and so on? They talk also about the competency-based CPD, or competency-based faculty development, or competency-based CME. So it's not anymore to be just lifted for who's interested to present something and so on, or designing some program. It should be also have some competency-based, like what we are doing with our learners. So again, those are still considered in the early area of research. So it's a
sorry, Dr. Mohammed. If it is okay with you, just to explain these terms, or if you want, we can.
Okay. So the programmatic assessment mainly has been introduced by CASE in Netherlands, and it is mainly talking about collecting dots to find that the learner is reaching whatever we are really happy to graduate him. So this is in just very simple word.
Sorry.
Yeah,
from
sure.
Maastricht University.
It's from Maastricht, from
yes,
Professor Case.
Professor of Luton,
Yes.
Luton.
Yes, for sure.
Whereby all the students from first to final class, they sit for the same exam 3 times per year.
Yeah.
And they see the improvement. And the evaluation does not depend on number. It depends on words.
Absolutely.
So, and the student should defend himself.
Absolutely.
If he cannot say, for example, professional behavior. If there are observations on him and he is denying, they discuss with him, maybe challenge him gently.
Yeah.
And they collect the evidence and they say the numbers are, they believe in this form of assessment that qualitative is not necessarily less than quantitative. It's surprising for first time we hear it, but they say that if you take biopsy, it's maybe more accurate than a number. For example, somebody may say hemoglobin is 11 or 9, but still he can climb the stair. So maybe the number may be wrong, and the qualitative, we should combine quantitative and qualitative. And the biopsy is a qualitative, not quantitative, but still it is the most valid. It is known for a long time that qualitative is probably more valid than quantitative. but here they put it into practice.
Absolutely.
And EPA is
Entrustable. Professional activities.
Professional activities, yes.
Again, it is from the same school, which is Maastricht School, and it is mainly of the, as Prof. Íad said, that it is mainly of the cumulative evidence of competency capabilities. So APAs, it has they are going from the practice back to the student. So let's say in family medicine, we have to have a consensus as a profession. What are as I said, EPAs is mainly that you go through from the practice back to the learner. So you have a practice of consensus of practices, certain number of practices, and with a certain articulation agreed by everyone. Then we go back to the milestone to build up those practice. So it is a sort of modifying the competency-based education to be more of handy tool in your hands. So instead of having, let's say, 100 milestones or 100 competencies under each pillar, for example, in Saudi Med or in CAM Meds or whatever, so you're gonna have 20 practices or entrustable practices, and you have to make sure that the student is entrusted to do it alone without supervision. So this is simply the
highest level.
It's the highest it's the highest level, and also they claim that it can be used beyond the graduation. So even in the relicensing, for example. I think competency-based CPD, I just explain it. If we can discuss it later on if anyone need to go through it. Here, why I put this, it's really funny that the way of summarizing the conferences and the recommendations of the conferences being changed. And this is very interesting that we have to think about it. This is an artwork by students in last AMI 2021 in August, and they used the art visualization of the summary of the whole conference. So this is the summary of the whole conference. So it's really interesting that we are going to see this often. Now, why I put this? Because I want to tell you that the direction of the research, it's really been implicated on the conferences, on the major conferences. AMI conference is considered one of the major conferences in medical education around the globe, and they are really having a very huge perspectives. So some of those really interesting that they are talking about the implication of bias, and by the way, they put one plenary session for biases in education. So again, for us, we have to open our eyes that this might be the direction of the research soon. Other thing about from Professor Dylan William, he mentioned a lot of tricks about the research in medical education. I'm going to talk about it just in a few minutes. The accountability, the planetary health, sustainable health, global health, all of these terms is really important. With the pandemic is taking more credit that we have to take, we have to think about it. We have to teach our students about our planetary health. And by the way, as we can see that the G20 recommendations is very strict about the planetary health and how can we maintain the environmental health of our planet safe. And in our local context in Saudi Arabia, we have a lot of talk about the clean energy, how to implement this planetary health in our faculty and our students. It's really a challenge, and I think It is very important, and it's under-researched in our context at least. So it is an area to go. Other thing is about interprofessional education. Interprofessional education is very important, and I'm going to talk about it just in a minute. So I just put here some of the example, how many sessions being given there in the last AME about racism, diversity, planetary health, international education, and so on. There are some of the resources also helpful. Interprofessional education, again, it is still, it was there maybe 10 to 15 years or 15 to 20 years there, but now it's been more out of is it work or not. Now they go beyond this. Now they are going more beyond the efficacy of having interprofessional education implementation, especially the focus now on the standards. So still, according to Prof. John Orsini and the group that in that workshop, they mentioned that we are still, we don't have a consensus about the standards of interprofessional education across the professions. So again, this is still an area for research, still area for development. One more direction, I like it. It was there before the pandemic, but I found it that it's now more focus on it, which is talking about the neurosciences in general. How can neurosciences affect the education, and what is the impact of neurosciences directions in medical education? For example, they are talking about clinical reasoning competencies, the distributed cognitive theory, even they are using now the technology. They are using the eye tracking technology in tracking where is the focus of the learners during the class, during the session, and we should direct our focus during according to the student abilities of cognition. So this area, it is really interesting. Some of them is I didn't find any research locally talking about this particular concept of cognitive part of learning process. So I think it's again another area of research. Now I just take you through a panoramic overview from my own perspective about what's been there in the literature helpful for the education. Now we're going to talk about some methodology. Now we have a change in the scope itself of the medical education research, and we have some changes in the methodology that people start use in conducting medical education research. Here are some general talk about the methods that when we are talking about medical education research methodology, it's we should put in consideration that it is different from the health care practice researchers. So regarding the controlled experimentation, so the concept of experimentation itself is really different when you apply it in the educational perspective rather than the healthcare perspective. The comparison, the big comparison, not always helpful because you have a very huge variety between the educational system and the learners themselves. Sometimes they said that well-designed small studies is much better than having a very weak huge study. Connection to theory is important. So all of our education has some theoretical background and philosophical background. So having this in mind, you have to tailor your research accordingly to reach a helpful outcome. Finally, the quantitative versus qualitative. So should we keep doing it separately? Shall we make it mixed? Shall we make each one after another. So this is another important talk. I will just adopt some of the Professor Diane Whelan talk about, a very important talk about research in medical education. And he put 4 important questions that any researcher want to do a research in medical education, he should ask himself, does it solve a problem that we have? And here is very important that we should tailor our research according to our needs, our problem that we are solving in our context, rather than just adopting some others or other context or other culture problem and implement it. As a Prof. Íad said that the School of Maastricht, for example, they have a totally different way of education system in the high school till the postgraduate. So adopting that as it is really not helpful for our culture. Then he talked about how much does it cost, and when he's talking about the cost, it was really interesting that he's not mentioning the financial cost or let's say the materialistic cost. Sometimes the cost is about the time that you are spending as an educator, or that learner is spending as a learner in that activity. Does it really worthy? Or if I can take this opportunistic cost and shift it to another activity, I